Special populations includes individuals who either have some sort of chronic problem which has been a part of their lives for the last several months, their entire lives, or maybe just a few years at a time. But whenever you encounter individuals who are members of special populations, it's imperative you pay closer attention to every detail of their program. And the bottom line is, if you don't have the patience and the understanding to work with people who are members of special populations, you should be referring them out. But first, we have to start with a baseline knowledge of the individual difficulties and challenges that people with special populations face. Let's begin the special populations module.
In asking what makes a special population, an individual that has a chronic condition or a specific situation which lasts months or years, this person requires special consideration or accommodation to their workout program, above and beyond the normal expectations for a healthy individual. Now, variables for each individual include a difference in not recognizing fatigue versus overtraining, not recognizing the difference between pain from exertion versus acute pain or pain from an injury or exacerbation of their symptoms, breathing hard versus labored breathing that could cause a concern for them in their situation, and the difference between a heart rate increase versus an arrhythmia, which could of course be life-endangering. There are certain guidelines that must be followed in working with individuals who are part of special populations. The trainer has to determine whether or not they're qualified to work with the person, and that they secondly want to help working with such a client. There's a risk versus benefit in that the person's always going to be better off working with the trainer, but the trainer has to understand the basic levels of capabilities and basic limitations of such a person, and they have to really want to work with them. Secondly, the trainer has to research information on the client condition in research journals and other sources, and also spend significant time talking with the client and their doctor about the situation. The trainer has to complete a very comprehensive health history, not only in terms of their health and history background, but also on specific medications they take and limitations they may have, as described by both the client and the doctor. And of course, medical clearance may be necessary to be obtained if this particular person has any concern whatsoever about a potential life-threatening situation occurring from working out with the trainer. And lastly, the trainer's job is to empower the client to be as independent as possible, to be as free as possible from prescribed drugs or outside care, to be able to do and perform activities of daily living without outside help. The best way to prevent a future problem or aid recovery is through a carefully designed program. Most trainers understand this, but extra care must be taken when working with someone who is part of a special population, because their needs are greater, their limitations are higher, and the concern is also higher. The risk is very high for such people. The goal of the trainer should be to either keep problems from occurring entirely or to slow the progress of limitations caused by the individual's condition, making sure not to exacerbate their condition and doing all that is possible to either alleviate problems or keep them from getting worse. As we age, there are certain functions that decline. We have limited capability to produce certain hormones. We have limited capacity for utilizing oxygen, and our endurance declines. Bones become more rigid and porous. There's a greater concern for osteoporosis. Certain neurological capabilities and coordination, basic functions tend to decline. Muscle mass and strength either level out or tend to decline. And of course, elderly individuals tend to have a lesser sense of balance, and one of their greatest fears, in fact, is falling, as many of their friends are falling, breaking their hips from simply going into the restroom and falling down while sitting down in the toilet, or getting up from a chair, or simply walking up or down stairs. They're very important and significant concerns that we must be aware of, which is of course why we need to train their balance. But there are also characteristics that increase as we age. Unfortunately, one of those is fat body mass, something that no one's very excited about. The resting and the training heart rate also increase, which is what we want to try to limit. We want to keep that down as much as possible, or at least be able to work at a high rate with a low heart rate in the ideal world. And lastly, unfortunately, as we grow older, we have a greater and greater dependence upon others for helping us with our activities of daily living. But it is of course, the main concern and role of the trainer to ensure that an elderly individual can perform as many activities of daily living on their own as possible. The concept of anti-aging has become very popular in recent years. And of course, the fact is we can't reverse aging and we can't stop the aging process. We are growing older and there's nothing we can do about that. However, we can seek to maintain as many abilities and skills as possible throughout our aging. One thing that will certainly aid in this process is exercising consistently to stimulate hormone production, to be able to produce testosterone, to be able to produce estrogen, to be able to produce the hormones that we do need for longer periods of time as we're growing older, which is certainly going to help our function. We're going to have more energy and we're going to be able to move better and not lose some of those skills and abilities that we tend to lose as we grow older. Training with increasing resistance will help slow the loss of bone, if not in some cases even increase bone density, and also increase muscle mass, and where possible, at least limiting its decay. Including basic balance activities for normal movement, multiplanar movement, so that elderly people are not concerned about falling. They can sit down and stand up without having to use their arms while doing so, not falling in their chair, but actually sitting in the chair and being able to walk up and down stairs with ease and change directions, reach down and pick things up off the floor. These are all very, very important, vital capabilities that must be maintained. And lastly, when talking to someone who is part of a special population who is older, it's very important you continue to use the rate of perceived exertion for frequent checkups to find out how they're doing. On a scale 1 to 10, how do you feel? And always changing the workout as necessary, depending on what they say. There is a lot of concern as to why there is not more information on how to train kids. The answer is simple. We should train adults like we train kids, and kids like we train adults. Kids and adults have the same biomechanical capabilities and limitations, and those biomechanical limitations and capabilities are based on genetics or the past background of movement or lack thereof, just like adults. Unfortunately, there are far too many kids who are becoming obese. Kids are becoming fatter because they aren't moving. Every kid eats some or a lot of things that they shouldn't, but the greatest concern is that kids play, improve their motor skills, and maintain their health and ability to function by doing as much as possible. Trainers have to make working out fun. If kids don't already work out, they don't think it's fun, or they think that playing video games is more fun. We have to overcome this. Kids should start by performing strength training with their own body weight and increasing load and intensity as long as they can control the movement. If the load is excessive, or a child experiences excessive force from trauma, like from falling out of a tree or someone running into them, to their femur or humerus going through the bone, the epiphyseal plate, which is found at the end of these long bones, could be broken, which can limit growth of that bone. After the age of about 17 and never later than 25, all bone length growth has been achieved. All children can and should exercise regularly as long as they can control the movement and can recover adequately. There is simply no need to treat young kids like Olympic athletes. They can do everything adults can, but they do not need to perform them as excessively as adults often do. Cardiovascular disease is a malfunctioning of the heart or the blood vessels. A heart attack occurs when there is death of part of the heart muscle due to a loss of blood supply due to coronary artery blockage. If a trainer has a client with a known cardiovascular disease, a medical clearance must be obtained from the client's doctor before beginning an exercise program. This is not just a liability concern, but in the best interests of the client. If you truly care about your client, you will make sure you obtain a medical clearance before working with them if they have a known cardiovascular disease. A client cannot change their age, and they can't stop aging. And damage to the heart due to a heart attack or due to some poor choices earlier in life cannot be entirely undone. But engaging in regular cardiovascular exercise, almost every day, and a moderate intensity weight training program at least 2 or 3 times a week can reduce the chances of a heart attack or stroke and lengthen the life of the client by improving circulation throughout the body to maintain all bodily functions, reduce body fat, lower their blood pressure, lower the low-density lipoproteins, which is the cholesterol that clogs the arteries, and increase the high-density lipoproteins, which is the cholesterol that helps clear the arteries. And exercise is the greatest impact, or has the greatest impact, on increasing HDLs, which we really need. And the bottom line is exercise decreases stress. As we grow older, if there's one thing we want to limit as much as possible, it is stress. Hypertension is a concern when a client has a blood pressure reading of 140/90 or greater. If either number is high, they are potentially hypertensive. A client can also be hypotensive if they have a low blood pressure reading of 90/55 and they are prone to being lightheaded or fainting frequently. Both situations exhibit a need to obtain medical clearance from the client's doctor before proceeding. Sometimes trainers will want to move forward with borderline blood pressure, but this is just not in the best interest of the client, something that a trainer must always keep in mind above all else. What the trainer or what the client wants and needs is far more important than what the trainer feels the client should want or needs. However, regular cardiovascular exercise can lower blood pressure significantly and reduce the effects of daily stress. Doctor-prescribed medications such as diuretics, beta blockers, ACE inhibitors, and calcium channel blockers all lower blood pressure, and the trainer needs to be aware of the effects of these medications as described in the manual. According to the American College of Sports Medicine, males with a body fat level at or above 25% and or a waist circumference measurement of greater than 40 inches are considered to be obese. Females with a body fat level at or above 35% and a waist size of 35 or more inches are also considered to be obese. While these numbers may vary in differences across age and gender, for the most part, these numbers hold true. Obesity is a concern due to the strain that excess weight and fat puts on the body and all of its functions, while also increasing the probability of an eventual heart attack. Obesity can cause or create altered hormone production, excessive strain on the joints, muscle and connective tissue, and the obese client will often have a decreased desire to work out due to a poor body image and a lack of body control. The obese client may also have increased muscular imbalances due to a sedentary lifestyle. The old use it or lose it principle always applies to the body, and the longer an individual goes without working a certain muscle or moving properly, the greater the chances are for injury or increasing likelihood that normal function may never again return. The bottom line is, in order to keep an obese individual working out and exercising regularly, the trainer must make working out fun. This is no small task. If the obese client does not enjoy the workout, they are likely to quit and never return. This is perhaps the most important task for the personal trainer in working with an obese client. Engaging in consistent exercise to increase the metabolism and burn more calories is crucial in helping the client lose as much as 1 to 3 pounds per week. Losing any more than 1 to 3 pounds per week is weight loss due to body water changes, and care must be taken to ensure that weight is not lost too quickly, or the body will find ways to ensure that the weight will also return quickly and with greater numbers. Weight loss is simple. Caloric intake must be decreased, and caloric expenditure must be increased to increase the metabolic burn rate. Choose exercises that are appropriate for the client's size and their ability. Don't have an obese client perform an activity that may aid in weight loss while also increasing the chance of injury or creating new problems. Discuss the client's goals, frustrations, and concerns. If the trainer cannot put his or herself in the client's place and show that he or she genuinely cares, the program is doomed to fail. The trainer must stress the need for consistency if the weight loss is to stay consistent and not be allowed to return. Asthma is caused by an involuntary constriction of the smooth muscles of the bronchial passage, limiting airflow to the lungs. Exercise-induced asthma from overly intense exercise can cause wheezing, shortness of breath, chest tightness, or headaches due to overexertion. Chronic asthma can be exacerbated at any time due to air pollution or due to certain allergens in the immediate environment. Most asthmatic individuals either carry an inhaler or are aware of what conditions or situations exacerbate their symptoms. For most, cool, dry air exacerbates symptoms, while others have problems with warm, moist air. Communicate with your client to be aware of what may make their asthma condition worse. However, it is important that asthmatic clients understand that light to moderate aerobic exercise can improve their condition by improving their aerobic capacity. If an asthmatic condition is exacerbated, breathing through the nose when possible may create a calming effect. The use of a doctor-prescribed inhaler may also be needed. Diabetes is a metabolic disorder due to problems with the production, supply, and recognition of insulin. Insulin regulates blood sugar and is normally secreted when simple sugars are ingested. The more simple sugars that are ingested, or the higher glycemic index foods that are ingested by themselves, the more insulin that is secreted, and potentially creating a huge insulin reaction. Type 1 diabetics are born with diabetes and often require insulin shots to regulate their blood sugar. Type 2 diabetics incur a diabetic condition due to poor lifestyle habits or behaviors with limited activity and poor dietary choices. It used to be that only younger adults incurred type 2 diabetes, but now even young children are becoming type 2 diabetics due to their poor lifestyle habits and lack of movement. Carbohydrates are not the cause of diabetic concerns. Eating starchy carbohydrates and/or eating carbohydrates with protein and fat may limit or even alleviate diabetic concerns. Side effects may include frequent urination, slow healing wounds, fatigue, blurry vision, and increased appetite and thirst when diabetic conditions are exacerbated, if the proper diet and exercise is not utilized. Now, consistent progressive cardiovascular exercise can increase insulin sensitivity, making it likely that many diabetics will not need to take as many insulin shots, and they will not have the same adverse reactions to carbohydrates with insulin reactions, and they can increase their weight loss to reduce the health concerns of diabetes. Diabetic clients should engage in a minimum of 30 to 40 minutes of light cardiovascular exercise every day. That's right, every day. Here's a list of some other special populations groups that you can find more information on in the PFT Manual's Extras for Experts section at the end of the manual. Any one individual who is a member of any one of these groups has specific concerns, just as anyone who is part of a special population does, and it's important that you take the time to research and go over this information prior to working with an individual who has such a condition, so you can be certain that you are giving them what they need, not just what they want, and that you're doing what is in their best interests for now and for the long term. We want to reiterate that it is never easy to work with someone who is part of a special population. They have specific needs and concerns that go above and beyond the average person. It's hard enough to work with the average person to motivate them, to keep them accountable, to make sure they continue to work with their exercise and do what they're supposed to do the other 160 odd hours of the week beyond the time they work with you, let alone for someone who has a special need like these people do. So it's very important as a personal trainer that the trainer be sure that they go above and beyond to work with these people, and if they're not willing to do so, they find someone else who is.